Hey guys, in this episode of Rona Rounds, I just wanted to start a conversation about moral injury. To be honest, I hadn't even heard of this concept or this term up until a few weeks ago. I read a few articles and papers on it, and the experiences that I read about kind of really stuck with me. In my non-eloquent nutshell, moral injury is basically the stress, despair, anxiety that we feel about having to do something that's outside of our moral code. The term actually was kind of originated from combat zones, but has been used a lot in medical situations as well. So for example, in this situation or in our environment right now, it'd be, that stress or despair you feel about not being able to treat a goals of care M1 patient with CPAP when they're hypoxic if your hospital is not allowing it due to transmission concerns. They also talk a lot about that personal feeling of burden you get from decisions that are made by higher ups, for example, the government or senior leadership at your site. For example, this would be, not feeling in control of PPE use, not feeling in control of treatments offered or provided to patients. A lot of the literature talks about the need to recognize worst case scenarios, think about limitations, both personal and institutional, before they happen in order to prevent moral injury. They also talk a lot about frequent, what they call campfires, aka debriefs, to kind of help limit the moral injury. This came from the concept that soldiers used to come back and have informal campfires and talk about their day and how that kind of helped prevent the moral injury. Rob Deloys did a great Rona Rounds recently, and part of his Rona Rounds discussed that some people with COVID present to the emergency room and deteriorate very quickly, that no matter what people have been doing, that they just cannot save some of these people. I think it's really important that we acknowledge that we aren't going to be able to save everyone, and it's not our fault, that is just the disease. I think it's really important that we take some time to figure out what causes us stress, what causes us anxiety, what's going to be the hardest for us. I know for me, the constantly changing guidelines on PPE has been quite stressful. I feel anxiety about the fact that maybe emerging clinical information isn't reflected in current guidelines. And I feel quite torn between wanting to provide non-invasive ventilation to patients, especially given some of the new evidence, but recognizing that it's not supported by some of our institutions and the risk that it provides to healthcare workers. I want you just to think about what brings you stress, what keeps you awake at night. I think it's important to put a label on the monsters and demons in your mind and acknowledge them, so hopefully they won't haunt us later. I would encourage everyone to find, a safe space, a safe group of people that you can talk to, where you can discuss anxieties, stresses, and hopefully that will help mitigate any moral injury in the future.